So yeah, Happy New Year everybody, welcome to the webinar. For those of you that don't know me, I'm Alex O'Neill and I'm Code's Professional Services Manager. What that means is I manage our consultancy team. I do quite a bit of the research into the CQC inspection reports and into compliance, and in Wales now as well with HIW. And I help Paul Mendelsohn and the rest of the team to develop iComply and to adapt it to the needs of our users. And I think I speak to quite a few of you on the phone. I do quite a few of the phone queries as well regarding compliance. And obviously the whole idea of this is with the research and everything, and with the phone calls, that we actually are constantly changing the system and modifying it to the needs of the users and for what the inspectors are looking for. So it's a live system, it's a living system. Today is a really interesting webinar. I've really enjoyed preparing for this one because we're going to look at lessons from the first year of the CQC KLOEs, the key lines of inquiry. And we're going to look at how that's been going and what key themes are coming out, and give you advice hopefully on how to prepare for inspections. So I'll jump straight into that and we will look at the aims and objectives. So as always, the aim is to increase understanding of the new inspection regime and to help you to prepare for inspection. We're going to look at how practices were judged on the key lines of inquiry in 2015 inspection reports, to identify key areas where practices can make improvements. That's one of the main things that I think you'll get out of today. And we're going to explore how the iComply compliance reports, we have spoken about this a lot, but I always think it's good to talk about it, and how the iComply compliance reports will help you on inspection day. And I also want to just touch upon a few key issues or recurring themes when we're dealing with queries, and to see if we can help you with that. So moving on to the next slide. So the learning outcomes. Hopefully by the end of this session, you'll be able to explain what the CQC are looking for under each KLOE, or more precisely where people are actually having issues under the key lines of inquiry. Because what they're looking for is actually quite straightforward. To be able to identify areas for improvement in your practice, and to demonstrate to an inspector how your practice is meeting the standards using the compliance report. And this is now also if you're in Wales. So we've researched healthcare inspector at Wales, we've looked at their inspection reports, what they're doing, and we've adapted the system for Wales. So it's now optimized to help practices in Wales. So if you do know anyone who has a practice in Wales, then you can let them know. So moving on now to the update. So we've looked at 495 inspection reports now that have been published on the website. I've tried to eliminate any practices that were re-inspected afterwards to look at the first inspection, and that's a total of around 495 reports. And the key sort of statistics are 18% of practices that are inspected are failing the inspections. They're in breach of at least one regulation and they're being told they must make improvements. So it's 18%. It was 20% when they started. It's now going down to 18%. 67% have been told that they could and should make improvements. So this is going up, and some of the lists you'll see in the inspection reports are actually quite long. And if you've had an inspection, always have a look at your report, because they'll have a list of things there that they're going to check next time they come in. So it says here, most practices are failing on safe and well led. I think it's around 100 practices. I've got the figure next door, but it's about 100 practices that have that failed the inspection, and 84% of those were on well led. So we're going to look at that in a lot of detail today. Well led is the big thing. Safe as well, but mostly well led. Everybody gets one chance. So what I mean by this is that they've said that dentistry is low risk. They've put the bar quite a lot higher, but they're giving you a chance. So if they come in, and even if you're in breach, generally speaking, it doesn't look, unless you're terribly in breach, but it doesn't look like they're coming in with the fines that they have, or the sort of the criminal, the prosecution powers that they were given with the new fundamental standards. It's more like they're giving everybody a chance. So where you'll see care homes being put into special measures, or GP practices being told that they must shut, that doesn't seem to be happening in dentistry. So the bar's a lot higher, the lists are quite long on your inspection reports, but it doesn't look like they're shutting anybody down. but there are about 5 or 6 practices where they've actually been clearly in breach. And we're going to discuss why that happened, and we're going to look at the key themes that come out of that and where they're really, what the CQC really are taking issue with as failings. Okay, so KLOE breakdown. Now I said on the last slide that 84% of people, 84% of those who failed on well led. Of the total number of KLOEs that everybody failed on, so a practice may have failed on more than one, this is the breakdown for that. So 50% of all breaches were on well led. 31% were unsafe. Effective, caring and responsive, really most practices are doing that well. So that gives you an understanding, hopefully. We'll look into more detail and we're going to drill down on that, but that hopefully gives you an understanding of where people are messing up and not meeting the standards. So, KLOE summary. Okay, so obviously these are the key lines of inquiry. We've got safe, effective, caring, responsive and well led. So I just want to give a brief summary of each of those. Now, I'm not going to go into great detail on these because that would be 5 webinars. And if this is your first webinar, which I think some of you said it is, fortunately enough, we put them all up on YouTube. So there is a webinar on each of these KLOEs going into great detail on them. But in a nutshell, I'm going to go through them one by one in a nutshell. So safe is massive. It's the biggest of the key lines of inquiry, and it's mostly around HTML 105, risk assessments, quality assurance, medical emergencies, recruitment, sharing learning, and mitigating risks in your practice. So creating actions coming out of those risk assessments. Effective. Being effective is about having proof that you assess people's needs, you give clinical advice and deliver treatment in line with legislation, standards, and evidence-based guidance. It's about recording all of this information in your clinical notes as you're required to. It's about your team being up to date with CPD requirements and you supporting them to be so through appraisals, etc. It's about inducting and training your team to be competent to deliver the services you provide to patients. It's about holding appraisals and identifying skill gaps. It's also about your team knowing how to deal with mental capacity scenarios. Under caring, caring comes down to treating patients with respect, dignity, and equality, upholding principles of confidentiality, as well as listening to your patients and giving them the information and time to make informed decisions about treatment. This isn't from the CQC, these are the summaries that I've created based on what I'm seeing on the reports. Responsive is about having a complaints procedure that's in line with guidelines, clearly displayed in your practice, and is understood by your patients and your team. So actually on the last webinar we did, I gave an example of when I went into a practice and I asked the receptionist how I would make a complaint, and the receptionist hadn't been trained on it. They had no idea. And the principal wasn't there, so there was nothing they could do, which obviously you'd never want a patient doing. It's about your complaints process being followed and, where appropriate, leading to shared learning. So feeding back into meetings, etc. It's about having clear processes for dealing with dental emergencies, that your patients are aware of the process for their emergencies, that they know your opening hours and that your opening hours suit your demographic. So if you're in the middle of the city of London, you probably shouldn't shut at lunchtime, would be a key example of that. It's about having appropriate appointment lengths, an appropriately staffed reception, so not one phone line without a hold system for a 5-chair practice or something like that. In the main though, it's basically about complaints, emergency access and disabled access, so that's responsive. And being well led is having a clear leadership and governance structure, leading by example, caring about what your team and your patients think, supporting your team to develop with appraisals as well, and PDPs, having regular meetings where you update your team and you share your learning again, and having a governance system that operates effectively and leads to continuous improvement. This is the quality assurance thing that is massive, and it's where pretty much everyone who's failing on well led, that's one of the main things which we're going to look into. It's about having an effective governance system, doing things properly, creating actions and following up on those actions. Okay, so common failure points. So What I've done is I've gone through all of those 490 reports and I've pulled out where the CQC were really taking issue with the practices that they really had problems with, that they had to visit more than once, that the problems weren't resolved, and they've taken enforcement action on those practices. And I actually came up with 5 key themes where practices are failing. So we're going to go through these, we're going to talk about these, and we'll talk about how iComply helps you so these aren't going to be an issue in your practice. So the first one is ensure availability and checks of all medicines and equipment to manage medical emergencies, giving due regard to guidelines. Now, obviously, we have the emergency drugs and equipment step in iComply, and you should have an AED in your practice and an AED sticker as well, displaying where you're or talking about where your AED is located. You need to check these your emergency drugs weekly. And you need to have all the right emergency drugs and equipment. And it's in iComply and it's covered in a step. So that's one of the main areas they're looking at. And if you're not meeting that, then you will fail your inspection. Ensure all staff receive necessary training and performance appraisals and are suitably supported. So annual appraisals, training plans, making sure that you're supporting your team, they feel supported, and they are properly trained to deliver the service. And we cover this with the CPD, the PDP step, the appraisal step. It's covered in multiple points in iComply and activities to help you meet the regulations. So I'm just going to take a sip of water. The next point, HTMO 105. Practices still aren't meeting HTMO 105 essential standards, and this is 6 years after it was published, 7 years. It's even longer, isn't it? We have our whole M257 kit, and we have a whole month that is dedicated to infection control in iComply and making sure that you are meeting the guidance. So I don't think I need to say any more on HTMO 105. It should be pretty clear to everyone by now. And obviously, if you have any queries about the documents, then as an iComply subscriber, you do get document support. So please pick up the phone and give us a call if something's not clear. Ensure dental x-rays, when taken, are justified, reported on, and quality assessed on each occasion. So this is under the effective key line of inquiry. They are looking at your clinical records. You should definitely do clinical records audits, and this is one of the key things you should be checking. 25% of practices in Wales, for example, this is HIW, but it's very similar, are not actually auditing their quality assurance of their radiographs, so they're not meeting the regulations. And in England, a lot of people aren't doing the audits as well, which we're going to see on the next slide, but they're also not justifying their x-rays, they're not reporting on them, and they're not scoring them. And having managed many practices, I have seen this on so many notes. Lots of notes do not meet the standards. So it's very, very essential, I'd say, to do a clinical records audit. And we introduced this at the end of last year because we saw how important this was going to be. So make sure you do a good clinical records audit, and your practice won't be sick practice like that practice on the right there. So, common failure points 2. So, ensure the practice establishes an effective system to assess, monitor, mitigate risks arising from the undertaking of the regulated activities. So an effective system, what they mean by an effective system is you're doing these things when you're supposed to doing them, you're reviewing them when you should review them, that they're leading to follow-up actions, and those actions are being completed within a reasonable time frame. iComply is that system. It does make sure that or prompts you, obviously it's up to you to make sure you do them, but it will prompt you to do your risk assessments, to do your audits, to create follow-up actions, and to do those actions and then feed those back to the team in meetings, or to put them on, or to inform your patients if you can. Risk assessments for Legionella testing. And action plan implemented in accordance with the findings. So this is a key point. I'm sure if I had a room here of people and we were doing an actual seminar, I'd ask you how many of you have read your external risk assessment that you had for Legionella? How many of you are 100% confident that you can that you have followed all the recommendations? Because what a lot of people we do, and the consultancy team sees this a lot of people do their get an external risk assessment done, tick the box, they've got their Legionella risk assessment, and then they never read it. So they maybe start doing some water temperature logging so they know they should do that, but there's probably 3 or 4 other recommendations that your risk assessor has made that are in your risk assessment that you're not actually doing. So a really good tip for all of you, if you've not done it, but as iComply subscribers, I'm sure you have, but have a look at, read your risk assessments, your external ones. So radiographs are, so audits, ensure that audits of various aspects of the service are undertaken at regular intervals, and that they should have documented learning points, and the resulting improvements can be demonstrated. Key point. The inspectors, they report on a fact basis, as in they will come into your practice, and if you've done the audit, fantastic, but if you've not followed up by creating any learning points, or you've actually followed up those learning points and you've got no proof, then you've not got the evidence. They unfortunately will not take you at your word that you have these actions in your head and you're dealing with them. They would need to see it on paper, and they need to see that they're being dealt with. And they need to make sure that any learning points that come out of this are fed back into staff meetings. So we have this in iComply, we're improving it for the manual system, and we're going to improve this in the application, but making sure that any points that come out of risk assessments and audits that can be discussed with the team, add them as any other business onto your meetings, and make sure that you inform your team. So, developing clear leadership, management and governance of the practice. Everyone knowing what the reporting lines are, who's responsible for what. So in iComply, we have this in the team responsibility section. Everybody knows what they should be doing. But a lot of practices that are failing on this point, the nurses aren't sure who's responsible for what, the practice manager's doing some things, the principal may be doing other things. So making sure you've got clear leadership, clear governance arrangements. Everyone knows who's in charge, everyone knows their place within the business. We are going to be adding to iComply in the very near future an actual management chart, like a template organizational tree that you can use to define your roles and responsibilities so everybody knows who's responsible for what. So this whole slide, this entire slide is basically having a system that you make sure you do the audits when you need to do them, that you do the risk assessments when you need to do them, that you identify problems, you deal with them, and that you follow, and that everybody learns from it. So that's the major thing where practices are. This is the well-led, basically. The other slide was more safe, and this is more well-led. Lucy's asked, how often should a Legionella risk assessment be done? You need to have an external risk assessment done once, and you need to review it at least annually. Now, whether or not that means getting another external risk assessment done is up to you to decide the level of risk. It's a risk-based thing, so there's no generic answer for all practices. And if you asked any inspector or any of the CQC or the Department of Health or anyone, they would give you the same answer. I personally think you do one once, and then you review it annually, and every 2 years or so, or every 3 years or so, you maybe get another external one done. And if your Legionella risk assessor says have it done every couple of years, I'd probably just do that. It'd be very hard to stand up in court and say that you're a competent person to risk assess a business for Legionella. Health and safety and fire are a lot easier. Okay, so moving on. So New Year's resolutions. I just put these down. These aren't going to apply to all of you. I'm sure you're all doing a really good job with iComply. But just key things, which I think from the consultancy we do, from the queries we get on the phone, just things that hopefully, especially if you've done a year of iComply, you'll be able to do these things, but you've probably done most of them already. But the first one is the principal and the manager understands the requirements. It's very easy just to follow iComply, but I have seen practices that on their CQC inspection report, it said, one practice especially that was in breach and they took enforcement actions against, it said the principal should familiarise himself with the Health and Social Care Act of 2008. So the principal was relying on the manager probably to manage compliance, and the principal who owns the practices and ultimately responsible for compliance didn't actually know what the requirements were. So in iComply, we have a lot of modules. They're the MDocs, and those are guidance, and that's our guidance, our summaries that we've created of the guidance. And we get a lot of phone calls from people who are asking us questions that are actually, and we don't mind answering them, but they're actually in the documents that you've got in iComply. And you can have a look at those, and we'll have a look where to find those. Everyone needs to understand their role. That's the whole leadership, management. Everyone knows what they're supposed to be doing and what their role is within compliance, and that enough time is allowed for compliance management. Compliance management takes 8 hours a week. It is now an 8-hour-a-week job. People do fall behind with iComply, we understand that, but you should be allowing 8 hours a week to manage compliance. We surveyed 10,000 practices, and that's what it takes these days. It's 7 to 9 hours. So you need to allow enough time for that. If you're a principal, you need to allow your manager enough time for that. If you're a manager, you need to have staffing arrangements that are flexible enough to allow you to do that. This is a key thing to keeping your practice working. So the second point there, read any external risk assessments and make sure suggested actions are being followed. That is, we talked about that before, but basically if you've had a Legionella risk assessment, if you've had a fire risk assessment done, if you've had all of your risk assessments done by an external company, it's a very easy thing for an inspector to come in and open them and just see actions that you've not followed, because you just tick the box by getting the risk assessment done. Now, as iComply subscribers, you're probably not doing that, but it's just a really, really good point. Get an AED and make sure that emergency equipment and drugs are in date. Audit your staff folders, get hold of missing documents, appraise and support. So go through your staff folders, make sure you've got everything. We do have in M203 on folder 7 page, we have a list of the sort of things you should have in your staff documents. And you can use that to checklist to make sure you've got up-to-date indemnity, you've got DBS checks. Practices fail for not having DBS checks, not having up-to-date indemnities, not having GDC details. All of these things practices have failed inspections on. So you just want to check that you have all of these, audit your staff files. We have had queries from people that have found out that dentist indemnity ran out 2 years ago, and a dentist has been working in their practice for 2 years without indemnity. We've had people who didn't check GDC registration of nurses they employed and then found out that they weren't registered anymore because they hadn't paid their annual retention fee. So really, really good to stay on top of your staff folders. And if you've been doing iComply a year and you're on top of everything and you're now reviewing policies and procedures and you've got time, I'd really recommend you do that. So, audit staff folders, make sure, and I said this before, make sure you've done a clinical records audit and you've done it, and it's the best thing to do is to do it as peer review. I wouldn't really, it's not a good idea for people to audit their own clinical records. I've seen multiple cases where the GDC has got involved because there was a complaint, and even though a clinical records check had been done, the clinician had audited their own records and they'd been too generous on themselves, so they hadn't spotted issues that somebody else might spot. So if you're doing a clinical records audit, then I recommend you do it as peer review. And then the last one there, follow the iComply calendar. All of this stuff above, generally speaking, if you're following in the iComply calendar and you're following the instructions, and you should be meeting these standards. So that's just advice there, mostly for people who don't have iComply, a little bit for people who do. And then the last point there is just if you follow the calendar. So new CQC Focus Points. So looking at the CQC inspection reports, what we're seeing is that they're looking a lot more at safer sharps in your practice, and we're going to be updating our guidance on this. We're writing it at the moment. It's a bit of a contentious issue, but if you really look at the European directive and British law, and now the British law on this, you have to have a very good reason to not have safer sharps in your practice and a risk assessment to support that reason. But generally speaking, it would be very difficult to stand up in a legal environment and defend the use of traditional sharps in your practice now. So Just a little bit on that. Prescription pads, they're looking a lot more at are you storing, especially for an NHS practice, that you're storing prescription pads securely and you're keeping a record of their numbers. We updated our guidance at the end of the year on this, but that's something they're checking. Sedation, they are now looking, and we are going to work on this and release something on this as well. They are now looking that practices are meeting the 2015 guidance that was published last year in April, and which you can find, that's in the CQC Provider Handbook. They list the name of the guidance, and it's they're looking that you're auditing in line with the requirements of the guidance, and they are looking that your team are having the advanced life support, so more than the normal CPR training. So if you are a sedation practice, you may need to update your training in line with the guidance and make sure that everybody, the whole sedation team, have that life support, advanced life support training. The last point there, lone working, they are now checking for lone working risk assessments if you need that in your practice, and we do have a draft of that we are passing around in code peer reviewing at the moment, and that will be with you shortly. Right. Okay, the future of dental regulation. This was published in December, the end of last year. I just want to touch upon it quickly because I am aware of the time. The CQC, the GDC, NHS England and the Department of Health all sat down around a table and said there's too much regulation. They said maybe in the future there's going to be self-assessment and not inspections. We can only hope. They said that they're going to have a single complaints process, which means that there's only going to be one way to complain, and it will be triaged in some way, as in you're not going to have the GDC and the CQC and they can't complain to everybody. There'll just be one complaint service. There's going to be support for failure. So if you do fail an inspection, they're hoping that the deaneries can get involved to help people to get back up to standard. And in a perfect world, they've said they'd like to work towards a single set of standards where if there's a problem, you only get one investigation by one body. It's a very interesting document if you fancy reading that kind of thing, but it basically says that the GDC, all of these bodies aren't even quite sure what each other do. And if there's a problem, they're not quite sure if they should be investigating it or if somebody else should be investigating it or who they should report it to. So they're trying to figure all this stuff out in the next 12 months. They've set themselves some targets which are very hard targets to meet, I would say. I don't want to go into more detail on it. It was just to give you a bit of information. But just to reassure you as well that with all of this stuff, we are keeping our eye on it, and if we need to adapt the system to changes that are coming, it will be adapted, and you will just need to keep following iComply. So no worries about, please don't have any concerns about dental regulation changing again. I mean, we've had essential standards, we've now got fundamental standards. It's going to change again at some point, but we will always be looking ahead and adapting the system to meet whatever the changes are. So, iComply is now optimised for Wales. We have the Welsh HIW released their annual inspection and their annual report of their first year of inspections, doing very similar inspections to the CQC. And it does seem that the Welsh practices are slightly less compliant than say English practices. We've got 30% of practices not carrying out cross-infection control audits, 25% not auditing radiography, 50% not following the complaints guidance properly. So we've now optimised activities for Wales, and we've introduced a new compliance report for Wales. Okay, so iComply in 2016. We're about to release an FGM reporting policy. Obviously, that in December that came in with the new guidance. It's very straightforward, but we're going to release that for you in the next. We're going to release that for you very, very shortly, next week, to be honest, or this week. And a lone working policy / risk assessment. We're looking into that. We've got regional events coming up. These are more for people who are interested in iComply application. We're launching the Quality Practice Scheme and the Quality Practice Award. And we've got these webinars every single month. So I just want to discuss a little bit about the compliance report and a bit about iComply. So just a couple of things. The first one was the compliance report. So quite a few people haven't been on the webinars, but if you have been on the webinars and you've heard this before, then it's just a bit of repetition, I'm sorry, but it's a key thing. We had some people I was speaking to recently who didn't understand how the compliance report worked. So when your CQC inspector comes, or your HIW inspector now, ideally, you want to be able to go down, you want to show them how you're complying. Everything you do in iComply, every time you sign something off, you date stamp it and it goes into your compliance report that is searchable by you or ideally the CQC inspector. So when your CQC inspector turns up, hopefully you can log into iComply, you can go down on the left-hand side here and you can click on compliance report. You've then got various options. So we updated the KLOE report very recently in line with what was coming out on the inspection reports as well. We originally based it on the provider handbook, but it's a live system, so we're constantly changing it. So we've got the key line of inquiry report version 2 there. That's the one you want to use on your inspection day if you're in England. And if you're in Wales, you want to use the HIW inspection report. Which is based on the inspection document that HIW very kindly publish on their website. So if you click on key lines of inquiry here, V2, and then click on inspection prompts, then what you see down here is you've got a list of, over here, the actual inspection prompts that they're using to inspect your practice. You've got a list in the middle of anything you've done in iComply, or the whole of iComply. And then you've got what it is, whether it's a risk assessment, an audit, a compliance review here, a link to the activity, and then some other boxes here, which is completed. So whenever you sign it off, that will change to a date here. We'll get a date here that says when you did it. Whatever you write in the green evidence box will appear here. So your notes here. And then where the evidence is stored will appear under here. So if we actually look at this one, say autoclave checklist, this is an easy one. And we click on view activity. Now, check that autoclave checklist logs are being completed. So you've got your autoclave checklists in place and you go and have a look and they're all being done properly, all the right testing is being done, fantastic. So that's ready to sign off. So we come down to the bottom here and we say, well, we didn't need to download any templates because they're already in place. We don't need to update anything and no actions are required. Now you'd want to check to see if there's any new version of the template as well. I should have mentioned that. But let's just assume that it's all fine. So you'd say, have checked logs and everything is being filled out correctly. No actions required. Something very simple like that. Now, what folders is it in? Well, you probably wouldn't you may keep the completed ones in an iComply folder, but most people will have a folder in their decontamination room. So you'd say decon room folder. So I'm going to mark that as complete. I'm going to click OK. Now, when I go down to here and I click on compliance report and go back to the KLOE V2 and I click inspection prompts, one second, it's gone down here now. There, you can see here, there's, for this particular one, do governance arrangements ensure that responsibilities are clear, quality performance managed, regularly considered, risks are identified, managed and understood. So autoclave checklist is something that they look at under well led. They'll also look at that under other KLOEs. So you may see the same thing a couple of times under different key lines of inquiry. So what date was it completed? So there's your date. So you can show the CQC inspector when you last did it. There are your notes that you wrote. So the CQC inspector can see that. And that's where it's located. So once you've been using iComply for a year, and you've got a complete cycle, this will all be filled out for you. And we're making some changes to iComply, so it will always show the latest time that you completed it as well. And we're constantly improving this report as well. So you'll have a full report that your inspector can look through and see what you did, when you did it, what notes you did it, where it's stored, and they can filter that. So they can come up to the top here, click on this toggle button here, and they can look under any key line of inquiry, and they can see what you did, when you did it, who did it, what date you completed it, what notes you left, and where it's filed. So they could just come in and just follow everything, and if you've got your folders there, they can pull it out, they can open it up, they can see your folders. So that's it's very powerful, this inspection report, and it's the key thing we think in iComply to helping you on your inspection day. So that's just one thing I wanted to mention. The other thing that I wanted to mention was just about the meetings and administration steps in general and how it works. So if I go to the calendar here, I'm only going to talk about this for a minute. So you see, this is iComply, or this is cycle 1, month 1. And you've got different things in the cycles. You've got administration steps, risk assessments, meetings. But generally speaking, the way to view it is each month is a mini cycle within itself. And there's a certain order to doing things. So your administration step contains all your policy reviews and everything. So you want to get all of those done, update anything, review everything, sign that all off. Once that's done and you've updated everything ready, you can give a team meeting. So you want to do the admin step first. Where practices get a little bit confused sometimes is when they're lagging a little bit behind and they try and do the practice meeting. They try and do the practice meeting before they've finished the administration step. And we had a query about this about 2 hours ago as well, actually. So finish your administration step before you do the meeting. That's one of the key things I want to discuss, because your meeting, the agenda that you've got in the meeting, if we go into the meeting here and we go down the related templates, you've got an agenda here. This agenda is based on your compliance reviews. So you can't train the team on those compliance reviews and those policies and procedures if you haven't reviewed them. So if you lag behind a little bit, then that's okay. But as I said, compliance is an 8-hour-a-week job now. So you need to give it that time to manage it in order to be able to get that meeting and get those monthly meetings done. And once you've done your first year, you'll find that the second year is a lot easier because you'll have familiarized yourself with the topics. Also, when you're doing any compliance review, so let's say, for example, we go into the administration step here, and we've got the consent policy and procedure here. If I click on that, then, okay, so the main thing you need to do in this step is you need to deal with a consent policy template. But what you've also got here is the code guidance on valid consent. Now, in your first year, you may have been getting all your policies and iComply and getting everything, setting up the system for the first time. Now, this year, when you're going through it, if you have the time and you haven't done it already, then when you're doing all of these things, then in related templates, try and read the guidance if you haven't had the chance. We go into quite a few practices and people have printed off this guidance and they've put it in a folder, but they haven't actually read it. So they don't know what the guidance actually is. And what we do is we read all the regulations. There may be 4 documents covering the same topic and we summarize that all into one piece of guidance for you. So if you've done your first year of iComply, or if you have a bit more time, then I'd try and familiarize yourself with all of these modules, is what we call them. And you'll notice that the main way you notice a module is it doesn't have a letter after the number. So you have M292 and there's no A, B, C, D. Those are the guidance documents.